Hello mga katribu! Welcome to another exciting episode of Pairfect. I am Francine.
I am Dina Ventura. Today we are lucky to be joined by a specialist who will enlighten us about a timely and relevant topic, COVID-19.
Let us welcome the head of Asian Hospital Infection and Prevention Unit, Dr. Joseph Adrian Buensalido.
Hello, good day to
Welcome to Pairfect.
Yes, thanks for taking the time. Doc, we'd like to ask you, how is your hospital dealing with the new Delta variant and the surge in COVID cases?
Yeah. Well, I have two hospitals. I'm connected with two hospitals, and in general, because of the Delta variant, uh, we're continuing to do what we have been doing, because essentially the enemy is still coronavirus. It's just that this new variant seems to be more transmissible. No? Mas nakakatawa siya, no? So, but what can we do to defend ourselves against this new variant? Is really to protect ourselves. No? And what do we mean by that? No? We must maintain our minimum health precautions, our minimum preventive efforts. No? And that continues to be maximizing the use of face masks, face shield, physical distancing. No? We have to make everyone understand that hand hygiene is very, very important, because if you touch something and then you touch your eyes, your nose, your mouth, those could be portals of entry for the virus to enter our body. And of course, all of those, no, education, kasama na rin yun. But of course, we always go back to the importance of vaccination, because yun yung makakatumbok, no? The others are, they're cheap, no, like masks, no, shields, no. Those are cheap interventions, but they're imperfect, meaning they cannot end this pandemic. No? But all of those together, with the final exclamation point being vaccination, we have a chance of ending the pandemic.
Okay.
So basic lang talaga.
Oo,
no?
basic and
Basic but
consistency,
critical.
di ba?
Oo, tama.
Don't forget. Kasi some people get tired of doing it
Oo
day in
eh,
and day
oo,
out.
Sabi nila may mask fatigue.
Pero Doc, I was just wondering, kasi you said hand hygiene, but is it is it just washing of hands, or any kind of alcohol and sanitizer will do? Parang I think people get confused also by what they should use.
Of course, the best is soap and water, no? But because we're on the move all the time, no? The next alternative would of course be hand rubs. No?
Hand
And
rubs.
in the hospital, no, we have by the door, by the patient, no, we have already have accessible hand rubs, no, because going to the sink is extra step, another couple of minutes, no, to go there. So we try to make the hand rub very accessible, so that healthcare workers, even patients, have access to it.
Okay, good. Oo. That's a good idea, no? Just surround yourself with with all these sanitizers.
Yeah, all bases
Oo.
covered.
So Doc, can you take us to the first time when the pandemic struck? How would you compare hospital care then to now? Has it worsened, changed? I don't know.
It was, the first wave. I call the first wave. I mean, in March of last year was actually the first wave. If you look at the DOH graphs, no, parang ang liit. Parang may tatlong bumps lang yung March to around April, no. But really, that's the first wave. If you look at the DOH graphs, although dun sa number of cases parang ang liliit, but the mortality rate ang taas, no?
Yeah.
Talagang maraming namatay nung March and April, no? It was because, it's understandable COVID-19 was new at that time. So we really didn't know what we know now. No? We really didn't know how best to treat it, no? In fact, in the past, no, before 2020, okay, how do we treat viruses in general? We used to treat it with, diba sabi nga natin, rest, drink lots of water, no? Of course, sometimes some supplements, no?
Yes.
But that was basically it in the past. So that was how we tried to handle coronavirus when it first came to us in 2020. No? I mentioned the deaths in March and April. That patay. That's really a learning process. But towards the end of March, no, we put our foot down. We said, I think we should try other things this time because this is not the usual virus that we have been facing in the years that have passed. No, so eventually we got the formula. We learned that for severe coronavirus infections, no, steroid was very useful. Why? Kasi ang COVID pala, virus that enters our respiratory tree and then it makes the lungs swollen. No? So what we tried many anti-swelling medicines, anti-inflammatory medications. No? Afterwards, we saw a real drop in patients who died, patients who got worse. So kumonti talaga yung mga nag-worsen, kumonti yung namatay. And then eventually, nagkaroon tayo ng antivirals as well. No? But in the past, pag meron tayong mga bacterial infection, mag-antibiotic tayo, antibacterial. Eventually, we also nagdevelop yung mga scientists and we were able to use antivirals, no? And so we were able to kill, in addition to preventing swelling of the lungs, worsening, we were able to kill the virus. So more and more as time went by, we developed more weapons against coronavirus. And right now, we are very confident now of how we treat and manage these patients. Meaning talagang bumaba talaga yung
That's good to know.
nagkakasakit ng masama and namamatay.
So, Doc, aside from the medicine, so, kasi a lot of people, siguro, marami ring mga home care treatments that they tried, like you should be drinking apple cider vinegar, uminom ng
Ginger.
salabat, ginger. Ano ba, are those effective? How effective are those home treatments? And what can you advise also? Maybe to supplement the medication.
Yeah. There's no, in addition to those that I've mentioned, no, really what can help us would be number one, to keep ourselves healthy. No?
Yes.
So that can, adequate rest, no, getting enough sleep, eating vegetables, fruits, no, and then of course, protecting ourselves. Those are really the things that are definite, no. Of course, there are some indirect things that we can do, meaning they have indirect evidence, no. In the past, no, coronavirus is not new, no.
Yes.
COVID-19 is new.
Yes.
But coronavirus, we've been dealing with this virus for many years, no. Hindi siya ganun kalakas dati, no, yung mga original coronavirus, no. Ito mga coronavirus na sinasabi ko nga, this is the number 2 cause of sipon or the viral upper respiratory infection. So sa mga dating coronavirus, no, gumagamit kami ng zinc para matulungan mapaikli yung illness ng mga may coronavirus in the past, no. So since coronavirus din siya, we still have been using zinc, no, to help shorten the illness. Of course, it's not, yung evidence namin for this is not direct evidence, but it's indirect evidence. Pero nakakatulong kasi there's also some indirect evidence, no, that vitamin C helps. No? So a couple of things that are cheap and readily accessible and we can use, no, especially pag pag wala pa tayo sa ospital. Although
Yeah.
even sa hospital, we still use these.
Just use everything, di ba?
Oo, siguro lahat ng healthcare measures, self-care, pati follow the doctor's orders. Di ka pwede maging sariling medicine man.
Kasi if you are just on your own looking at the internet,
Oo.
marami na uy, ito ginamit ni ganyan, ito ginamit ni ganyan, ito ginamit ni ganyan. So we have to be discerning, and usually that's where the doctors come in because of course before we prescribe anything to patients, no, look at the benefits, the risks, no, of whatever we're going to give, and if the benefits outweigh the risks, no, and naman mahal masyado, then we give that.
Okay.
I remember during the early months of COVID, ang dami talagang suggestions on social media, on
Oh, because people wanted to know how to handle it. Eh.
Yeah, siguro we're still in the dark.
Yeah.
Pero, Doc, ever since our nurses and doctors have always been the real frontliners of this crisis. But right now, almost 2 years, we've been hearing about threats of mass resignation by our
Nurses.
health workers. So, what are your thoughts? Because they're simply overwhelmed by the situation. What are your thoughts on this, Doc?
Yeah, of course, after a year, more than a year, it's understandable that the medical workers, no, will really get tired, no? Especially during surges, no. Hospitals get full, no. We get tired, we get sick, no. So for those healthcare workers who are getting tired, it's understandable. Of course, sometimes, of course, they want to quit, etc. They want to resign. No? Some have expressed their desire for mass resignation. No? Of course, we cannot, feel negative or, show something negative to them because that's what they feel. No? But then, I am hoping, that we are in a war.
Yeah.
And this is our war. I've mentioned this in the past, that if our grandparents had World War II, or possibly our ancestors World War I,
Yeah.
this is our World War. And unfortunately, we are dealing with a virus that we cannot talk to. No? Walang mga peace talks, walang mga treaties. Walang yan eh. It will just come and come and come at us. No? And you're right, we are the frontliners in a sense, no? And we get tired, but I'm appealing, of course, to my fellow frontliners. No, maybe it's not the time. No, it's maybe a good way to tell the government, no, that hey, take care of us as well. No, but maybe to do a mass resignation might be bad. It definitely will be bad for all of us. No?
Yes.
Just we should air our grievances, no. But at the end of the day, let us appeal to them, no. Me, to before we do something drastic, let's think of everyone else at the same time.
The higher good, no? It's very hard. It's really
Yes.
a battle of
Yes.
strength then.
Strength and will and dedication din. Ano? But then, we're all humans.
Yeah, so Doc, we'd like to know if the worst really is not over with the Lambda variant coming in, recorded already. But before you answer that, we'd like to pause for a short break.
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM.
Vaccination, isolation, gotta keep up with my nutrition. Gotta maintain my body condition, then I can take my vaccination. What do I choose? What do I take? As long as it is not a fake. AstraZeneca, Moderna, BioNTech, even Sinovac, okay na. Babakuna ka ba? 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 Vaccination for the nation, no more isolation. With vaccination, babakuna ka ba? 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 Paturok, paturok, paturok.
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM.
And we are back on Pairfect with Dr. Jondi Buensalido, Head of Infectious Diseases at Asian Hospital.
Infection prevention
Yes.
unit.
Okay.
Whatever. Ganun na rin yun.
So, Doc, before we pause for commercial, we were asking about the Lambda variant. So, a lot of people are scared of it, of course, with what we know so far. What can you tell us about variants? How do they develop? And how afraid should we be of the Lambda
Yeah,
variant?
should we be very scared?
Yeah.
Kasi more things to come. We thought already we've
Past
learned how to
oh.
control the disease, but right now with more variants coming
Yeah.
in. So,
Yeah. So for me to explain what variants are, no, we go back to coronavirus. No, let's imagine coronavirus as a robber, no, magnanakaw. Hindi natin magnanakaw yung coronavirus. No? Siyempre, marami nang nagawang kasamaan itong coronavirus. Marami nang napatay, no? Marami nang napunta sa ICU dahil sa coronavirus na ito. But like all robbers, nor all thieves, no? After they've done their crime, of course, what do? They try to escape, no? And what do? Variants are simply, to make it simple, ways that this robber or enemy tries to change itself, no? Like for example, kung magnanakaw ka, no, coronavirus, pwede kang maglagay ng bigote, no, para hindi ka makilala, no? Because then naturally you want to escape punishment, no? Or maglagay ng wig, no? So variants are essentially those things, no? A virus that tries to change itself to evade or escape punishment, no? Killing by us, the doctors. They don't want to be killed by us. They want to continue what they're doing, no? So, in a sense, no, if we are unable to stop this pandemic and the robber or the virus continues to be able to go out and do what it does, no, there will really be variants that will arise, no, kumbaga. And how can we prevent these variants? It's natural, eh? They will really change, you know. That's what they really would want to do. It is really for us to stop variants from forming and spreading, you know. We really need to stop this pandemic. And like I said, no, infection prevention will imply using of masks, no, shields, distancing, alcoholization of our hands, no, washing our hands, and then finally vaccination. And not just vaccination na mabagal, no. Kailangan talaga mabilisang vaccination, eh, because tandaan natin that this virus wants to escape. What is this vaccine ba kasi? Ano bang ginagawa ng vaccine? The it really just shows our immune system, the poster, ano bang itsura ng virus na dapat namin abangan. That's essentially what a vaccine is. It shows our immune systems that this is the virus, this is what it looks like, this is what you attack when it comes near the body. No? Now, if the virus changes its appearance, naturally the vaccines will lose its effectiveness a little bit, no? At kung talagang mag-change yung virus into a bad variant, talagang ibang-iba, baka hindi na talaga mag-work yung vaccine. Which is why we are doing double time in trying to vaccinate everyone. Kasi yun yung ating hope to end this pandemic, which is to get herd immunity. Dati nga
Yes.
70 to 70% of us immune. Estimates ngayon is that because of the very infectious variants, baka kailangan 90 to even 95% immunity as a population for us to end the pandemic. It's merong time component, no? Hindi lang pwedeng, sige, bakuna na lang ako next week. Kasi that gives time for that robber virus to change. And baka next week, pag siya, baka hindi na mag-work yung vaccine. And then we're back to zero.
Yeah.
Nako. But Doc Jondi, are we doing it right? Are we on the right track? Are we doing the right health? Are the health protocols enough? If not, what else is there to do?
Yeah, really. But the problem of vaccine availability is worldwide. No?
Yes.
Kasi it's a pandemic, so everyone needs the vaccine. So countries are doing their best to, kami naman, can we get more of the vaccine? And as if we see in the news, no, vaccines have been coming. No? It's really, so we make the most of the supply that we get, no? Because every other country also needs the supply. So whatever we get, we really have to distribute it to the population. Of course, first to those who need it, no? Most need it, no? That's why we have yung priority groups, healthcare workers, A1, or 60 and above, A2, A3, yung mga may comorbids, no? And then A4, frontliners not in healthcare. So may listahan yan, and we have to continue giving these para umabot din naman dun sa mga less at risk, no? Now, of course, there are other things that we can do, no? Na, of course, we can improve yung contact tracing. We have to really, improve on it, no? And what else? Yung education, no? Kasi nakita ko yung numbers, yung elderly, hindi pa rin hindi mataas yung numbers, no?
Yes.
Education, no? Media, no, can help in that respect, no? But in general, those are things that we can improve on, no? Dapat maintindihan ng mga kababayan natin na yung bakuna hindi ginawa yan para makasama sa atin. To protect us, no? Kasi there's suspicion, no? I think yung Dengvaxia controversy
Really
nakasama.
affected
Yes.
perception of vaccines. And
We have to understand na ginawa yung bakuna to protect us, not to hurt us. No?
Okay.
And hindi yan papasa, hindi naman ibibigay yan sa population. If the risks outweigh the benefits. In this case, the benefits are for us and they outweigh the risks, no? So we should get it or else wala tayong papatunguhan.
oo nga.
Tama.
Pero speaking of vaccines pa rin, Doc, ang dami kasing mga lumalabas na balita about it, di ba? Efficacy of the vaccines against the new variants like Delta and Lambda. Some say hindi na effective yung ibang brands. So we're talking about brands here now because they're made differently, di ba, Doc? And then there's also that question of vaccinating the young, the children, ganon, and
Pati booster shots.
booster shots kailangan na rin daw because the variants are getting much more
Yeah.
Stronger.
Yeah.
Mas maangas na mga variants.
yes. So and then granted that di ba, COVID is a strange animal. We don't know how it's gonna turn out. Ano yung masasabi niyo, or how can you clarify all these doubts and questions in people's minds about
About
vaccines?
vaccines, no?
Yeah. So, totoo yan. Totoo naman talaga. In a perfect world, no? Dumating yung yung ating kalaban. Gumawa tayo ng perfect weapon. Talo yung kalaban. Itong kalaban bago actually, no? If you remember in 2020, no, dumating yung COVID, no? Ano yung ating prayer noon, no? Sabi natin, sana dumating na yung sagot sa problemang ito. Sana hanap na tayo ng panglaban sa COVID, no? Sana magkaroon na ng bakuna, no? Now fast forward 2020 to 2021. March, no, dumating yung unang bakuna sa ating bansa, no? Okay, so dumating na, no? So yung parang hinihingi natin, dumating na. Of course, sabihin natin hindi siya perfect, no? Hindi naman talaga perfect, and all vaccines are actually not perfect, no? Okay? Pero these were, like I said earlier, these were designed to help us, to protect us, to give us some form of protection. And lo and behold, no, if you think about and look at all the vaccines available to us right now, it's universal that all of them are very good, no, 90+% to 100% good at preventing severe disease and critical disease, yung the worst types of COVID, no. So kumbaga, it will prevent us from going to the hospital, will reduce our chances, no, of going to the hospital. It will reduce our chances of dying because of a severe or critical coronavirus disease, no? So that's pretty good, no? Sasabihin ng iba, magkakaroon pa rin naman ako eh. Oo, pwede ka pa rin magkaroon kasi baka magkaroon ka pero baka mild na lang or moderate na lang.
Yeah.
It's very effective, no? So that's one. So wag natin baliwalain yung nandito na sa atin, no? Kasi kahit pa sabihin natin hindi kayo nagtitiwala sa brand, no? Which I think we should actually not be like that, no?
Oo nga.
Always go back to the fact that these vaccines, no, kahit hindi mahilig ka sa branded, di ba? Because why? We are in an emergency situation. Sabi ko nga parang Titanic na lumulubog, nandun tayo sa emergency situation. Pag nagbigayan na ng life vest,
Kunin mo na.
gusto ko yung padating na shiny new life that may or may not arrive soon, no? Pero kasi emergency eh. Kaya sasabi ng mga tao sa Titanic, kunin nyo na yan. Why? Kasi lahat naman ng vaccines or life vest were designed to try and save us. No?
Galing nun. Ang ganda nun.
Gusto
That's
ko yung
an easy-
metaphor na yan.
Yeah.
Yung sa Titanic, no, 'di ba si Rose naka-life vest? Si Rose. Nabuhay siya.
Yes.
Si Jack namatay kasi walang life vest si Jack, no?
Yes.
So, tapos 'di ba may parang nakahiga yata si Rose din sa parang piece of wood. Maganda sa vaccines, no? As opposed to the usual life vest. Ang vaccines, pag sinuot mo yung life vest na vaccine, extend yung protection. It doesn't protect just you, the wearer, but it also protects those around.
People around you. Ang galing.
Napakuna ako. Okay, ako yung pinakaunang nabakunahan dito sa bahay namin, no? But after I got my vaccine, and syempre lumalabas ako, pupunta ako sa ospital, na-expose ako sa COVID, no? I can bring, of course not intentionally, bring the coronavirus here in my house and maybe infect my wife, my kids, no? Pero ang vaccine, dahil bakunado ako, may protection ako. So COVID or the virus has a difficult time entering my body. And so far, because I've been vaccinated, no, I have not brought the virus here. Kumbaga, it also protected my close contacts, specifically my family.
Naku, Doc.
Selfish eh. It's not a selfish intervention, no? 'Di ba? Pag magpabakuna ako, it's not just for me, but also for my close contacts.
Galing.
Pero
I like that.
Doc, just to clarify, kasi madalas naririnig namin it's possible that that we can still be carriers of the virus, di ba? So does that mean na kapag nabakuna ka, hindi ka na magiging carrier ng virus?
You know, so the vaccine is not perfect. No vaccine is perfect, no? So we will need to continue masking up, no, shielding down, hand hygiene, distancing ourselves. It doesn't mean that, di ba, parang parang ang sabi nila, parang helmet naman, no? May narinig ako recently, nagsabi na yung vaccine parang helmet, no? It will not prevent a crash, but it will prevent you from, getting complications from the crash, di ba? Kunwari, nakamotor ka, pwede pa rin ma-aksidente. Pero dahil sa vaccine helmet, pwedeng hindi ka malumpo. Diba?
Tama. Oo. I like that, the simple explanations, no?
Motorsiklo, dapat pa rin, tumitingin ka pa rin pag, pag liliko, no? Huwag masyadong mabilis. And that also means that pag nakabakuna tayo, hindi ibig sabihin tatanggalin natin yung mask, tatanggalin natin yung shield, lalapit na tayo sa crowds, no? We should maintain all these protection, no? Bakit? Tatanggalin lang natin yan pag na-end na natin yung pandemic, no? Kasi yun natin. Kasi if we just think that one intervention will stop it all for us, it won't happen. It will entail multiple different interventions, patience, determination, and cooperation from all of us.
Okay.
It's a good idea.
Yeah.
So, Doc, let's go back to your team at your disease infection prevention and control unit. What are some of the practices that you've made so far, and how do you try to keep the team together? But before you answer that question, we'll pause for a break.
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM.
Ang bayan kong Pilipinas, hirap ang dinadanas. Sari-sari ang problema dahil sa pandemya. Matapang ang Pilipino, matapang tayo. Kakayanin natin to, kaya natin to. Like Andres Bonifacio, he is our hero. Hindi atakbo, hindi atakbo. Nandiyan na ang bakuna. Magpapaturok ka ba? Supilin na ang pandemya. Magpapaturok ka ba? Huwag mawalan ng pag-asa. May pag-asa. Malapit na ang ginhawa. May ginhawa. Mawawala ang pandemya. Mawawala na rin yan. It's gonna be okay na. Okay na. Okay na. Okay na. Nandyan na ang bakuna. Magpapaturok ka ba? Supilin na ang pandemya. Magpapaturok ka ba?
Service Advisory is brought to you by Daily Tribune and 100.3 RJFM.
Hello, and we're back. I'm Francine, and I'm with Dina, and we're talking to Asian Hospital's head of its Infection Prevention and Control Unit, Dr. Jondi Buensalido. Hello again, Doc. We're back. Yes. And I was asking you before we had the break, how do you try to keep the team together as the head of your unit?
I'm
I
sure
can
this is-
imagine the day-to-day challenges and struggles.
Yeah. Well, it doesn't hurt that the team itself has been a well-oiled machine, no? Since I became chair. No? So
Okay.
the previous infection control chair, Dr. Marian Dweck, and of course we have our very supportive Chief Medical Officer, Dr. Lito Aquin. And and it also helps that I have JP Flor, our nurse manager, who really helps me, run the infection prevention and control unit. Really, when it comes down to it, it's really just as I mentioned earlier, patience, determination, and teamwork. Because it's really a challenge, Kasi ang infection prevention and control really just does not look at COVID, but because of this new COVID-19, nadagdagan talaga yung trabaho namin, So, but of course, we also continue to do the other infection prevention and control measures and strategies that we do in the hospital, non-COVID related. Pero definitely, nadagdagan yung trabaho. And I would like to thank the team, that we continue to do what we're doing. Of course, we lost some people along the way, natural din yun. But at least the team is still intact.
Okay. Doc, how many people are we talking about in your team?
Less than 10 people, but then the committee itself is big, So we meet every month, almost every month. But when we meet, it's not just the infection control team; it's also the many other services and other in the hospital, including nursing, purchasing, everyone, even yung mga naglilinis sa hospital, they're included, security. So everyone, kasi all of the whole hospital will need to have the same guiding principles in terms of infection control. So we have to be in touch with everyone, and we shouldn't miss anyone because any portal of entry. I mentioned portal of entry kanina for us as a body, but the hospital in itself has many portals of entry. Saan pwede makalusot yung COVID?
Oo.
So all of those, and hopefully we don't miss anything para hindi makapasok yung COVID sa hospital. And yesterday, actually 2 days ago, we met again, and I'm glad to say that the latest numbers of Asian Hospital is that 95% of us have vaccinated. So we have our own herd immunity in Asian Hospital right now.
Galing. Okay
It's
yun.
good to know.
Pero Doc, is this the worst time for you as a doctor? I mean, I know it's very hard now, this COVID pandemic.
Well, it is the biggest problem for an infectious diseases doctor, But this is I've heard this before. One of my colleagues said, this is what we've trained for, and it happened during our watch. Naturally, we are the ones in the forefront, but it's not really just us, It's really a collaboration from infectious diseases, pulmonary doctors, cardiologists, Actually, the whole hospital, hindi lang yung mga doktor, the nurses are very, very essential, And actually, even the allied health team.
Yes.
So it's really the worst thing that can happen, for us, as a society, to get this infectious diseases problem that is just yung mahinang klase, but it's a very infectious cause, and unfortunately, it became a pandemic. If you remember the original SARS, in early 2000s, no, within a year, natigil siya, di ba? Or around a year's time.
Oo.
But first, no, it's already more than a year na, and it's going and going pa rin. So, it's a much bigger problem, and it's something that is, very bad, but it also brings out the best in all of us, no? In a sense, in one sense, no? Because dito lumalabas yung pagtutulungan, no? Of course, merong mga problema syempre along the way, but we really have to get over these problems and just find solutions for these problems.
Doc Jondi, you're a parent yourself of two adorable kids. And knowing what you know right now about COVID-19, what would be your advice to parents?
Well, number one, we have to follow the recommendations. No? Right now, naka-ACQ tayo, it's really the recommendation not to bring our children out. No? And one of the reasons is because we cannot vaccinate these children yet. No? But again, a corollary to that, no, since we cannot vaccinate them yet, we should, the ones who are eligible for vaccination, should get ourselves vaccinated, no, to protect them. No? And kung kunwari, meron tayong elderly sa bahay, to protect the elderly in our houses. No? So that's one. No? Number two, it's a good time to also educate our children with regard to infection control, no? And hygiene, no? It's a good time, no? To actually everyone, but including our children, who hopefully, when they grow up, they will bring with them how to effectively prevent infection from entering their bodies. No? So number one is hand hygiene, covering our mouths when we cough or sneeze, no? Or even before we touch our eyes, nose, and mouth, let's do hand hygiene, because, like I mentioned earlier, these are the sites of entry that viruses or other bacteria can choose to go through, penetrate our defenses. No? And just follow, health precautions. No? Pinapalabas ko pa rin naman sila, pero at least 15 to 30 minutes in a day. Pero dun lang just to get some sun exposure.
Okay.
Vitamin D,
Oo,
right?
So kasama yon, they have, kasi syempre ngayon nasa bahay, may gusto nila ng gadgets, di ba? Ngayon ang kids like gadgets these days. No? Pero meron silang listahan, parang checklist, kailangan all 15, kailangan magawa nila yan bago sila makahawak ng gadget. And of course, during school time, bawal silang mag-gadgets, no? Monday to Friday. Monday to Thursday, kasi Friday afternoon pwede na sila. Pero try to limit it. And one of the strategies is by having that checklist na kailangan na check na nila yan lahat ng nagawa bago sila makahawak ng gadget.
Galing, ano?
So may routine
gusto
pa
ko
rin.
makita yung 15 na yun.
Oo nga. So may routine pa rin sila, no?
Oo.
Kasi mahirap naman kung ano.
Yeah, to give them some
Baka
structure.
they'll think it's a vacation forever.
Doc, na-curious lang ako. How did you become a doctor and why did you choose infectious diseases to specialize in?
Yeah. It was easy for me to become a doctor because my father is a physician. No? So he was actually my idol growing up and continues to be my idol. So it was easy for me to choose medicine. No? But the truth is, on the way to that medical degree, I actually became a geologist first.
Oh.
I practiced as a geologist in Surigao, in Mindanao, in Dinagat Island to be exact. No? So it was there, no, and it was there wherein finally I decided to become to continue and pursue that dream of becoming a doctor while on the mountains. No? I called back home. There was a party at home. And of course, nainggit ako. Tapos my lola, who really wanted me to become a doctor, was there, talked to me, and said, hindi mo ba talaga mag-doctor? Sabi ko, sige na nga. ako dito ng ng review materials, and during my break, kasi in the past I would just get 15 days of leave as a geologist. So pagbalik ko sa Manila, I took the exam. I passed it. So it started from there.
Okay. Talino ni
Napaka-ano
Doc.
pala, no? Parang mahabang journey
Oo.
with a lot of reflection on your part, Doc.
Mahaba, no? Kumbaga parang pumunta muna ako sa side trip, and then went back.
Oo nga. Pero Doc, now, parang these days, it's a very different situation for doctors, especially with your specialty, as you said before, kanina. How do you handle the pressure? I mean, what do you tell yourself when the going gets tough? No?
Well, there was there's this one quote, no? This too shall pass, no? So, it's been our training naman since medical school, residency, fellowship training, no? We were trained to be patient, no? Because doctors are actually simple lang naman yung doktor eh. The problem, there's a solution, no? And we are right now smack in the middle of a big problem, and like I mentioned earlier, we didn't know the solution at the start. But through persistence, we doctors study for life, no? So when there's this new problem like COVID-19, we didn't just rely on what we knew. We relied on what we knew at the start, no? Kasi syempre we needed to evaluate how to treat this. But as more data came in, more experience came in, no? Eventually, heads together by many different doctors and specialties, no? We were able to get the best management strategy, and that's what we do now, no? And we're pretty confident these days that what we do really helps patients, but by reducing mortality and preventing ICU stay, or making it quick for them to be in the hospital.
It's nice to know that we have doctors who are so zen.
Yes, exactly.
Kasi parang magpapanic sila along with everybody else.
Especially
Paano
with
na
all
tayo?
this, with all this information, di ba, the overload information about COVID-19.
Yes.
Yes.
We call it the infodemic. So meron
Pandemic, tama.
call it infodemic, and actually when we were in training, we were taught how to to do critical appraisal, no? And of course I have to thank my mentors, no? Because they were the ones who taught us how to appraise information and decide whether it's useful or not, no? And of course my mentors were responsible for helping be knowledgeable in critical appraisal.
Yan.
Yan. So, sabi nga namin kulang na kulang ang 40 minutes to talk, Jondi, about everything. We try to really keep it compact, but it only means we'll have a part 2 of this talk soon, di ba? Promise us, Doc Jondi, you'll say yes again. Yes. So, there you have it, mga katribu. Thank you, Doc. But before you go, we'd like to ask you some parting words to our public, to our viewers right now.
Yeah, we've been in this war since last year, no? Nakakapagod na talaga, no? Pero ang aking pakiusap sa ating mga kababayan, kapit lang tayo, no? And then we mentioned critical appraisal, no? Dapat critical thinkers din tayo. Hindi lahat ng maririnig natin yun agad yung papaniwalaan natin. We are here, no? Your doctors are here. We've been fighting this pandemic with you, no? Lahat tayo sama-sama. We've been fighting this pandemic with you since last year. Of course, let's please, no? let's get vaccinated, no? Continue masking up, using our face shields, distancing ourselves from others, no? And continue performing hand hygiene. There are some, if you look into the news these days, no? Parang even yung ibang mga experts are ready to give up, no? Oh, I'm not ready to give up, no? Historically, we've had many pandemics in the past, and these pandemics all ended, no? So I'm still very hopeful that this pandemic of ours, no, will end, but will really entail all of us working together, which includes the things that I've said, plus vaccination, no, because this is our best chance to end the pandemic if we can achieve herd immunity. Okay, so let's get vaccinated if we are eligible, no? And let's of course, for the last thing that I have to say, let's all pray, because God will be there, will be guiding us, and He will actually be the one to decide when to end this pandemic. But we have to help ourselves as well.
Yes. Oh, I
Well
feel so
said.
reassured.
Yes.
No, I didn't know that I needed to hear all these things, mga simple reminders.
Straight
but
from the
really,
expert.
Yes, so
Yes.
thank you very much,
Oo,
doctor.
oo. We had a very enlightening afternoon today. Enlightening and inspiring.
Yes.
Yes, with Asian Hospital's head of its disease infection prevention and control unit, Dr. Joseph Adrian Jondi Buensalido. Thank you, Doc.
Thank you. It's been a delight to have you on the show, and we
Yes.
hope to see you in our future ones.
In a part 2 of this episode, Pairfect Talk. Pinaparinggan na talaga si Doc.
Binubok na yung appointment.
Binubook ng appointment namin sa'yo.
Okay, so thank you very much, everyone, for watching
Yes.
Pairfect. I am Dina Ventura,
And I'm Francine Marquez.
and this is Pairfect.